Welcome everyone to today's webinar. I'm Malia Pavola with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a few questions and answers. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to turn the floor over to Kevin to begin today's presentation.
Hi, good morning, everyone, or maybe I should say good afternoon or good evening, depending on where you're dialing in from. I guess we have over 800 registered participants, and we really are grateful for your attendance today, and we hope to have a good, lively discussion. The topic for today is 2020's silver lining, and boy, what a crazy year it's been. Pandemics, fires, Supreme Court justices dying, and a general election right around the corner. No stress there at all. Is there a silver lining? Who better than today's panel to have a discussion around that than who we've assembled for you today? And remember, there's a Q&A at the end. We'll leave some time for you, so as we roll through these slides and we go through the discussion, remember this is really for your benefit. You have anything that you've been dying to ask any of our panel, this is the time to do it. My name's Kevin Perot. I'll be moderating for you today. I'm the founder and CEO of Transcendent Health. I'm also the author of The Digital Health Revolution. Joining me is Ray Costantini, CEO and co-founder of Bright MD, Ann Mon Johnson, CEO of the American Telemedicine Association, and Corey Schmidt, General Partner for 7 Peak Ventures. So let's kick this off. Corey, I'd like to start with you. Andy Slavitt has conditioned me to sort of always frame these healthcare discussions around healthcare's triple aim and corresponding threats. And as I look at COVID, I get an appreciation for why we get a twofer. So maybe we could start the discussion off with some comments around how COVID has affected hospitals and healthcare systems regarding patient access and provider morale.
Yeah, thanks, Kevin. You highlighted some struggles we're seeing across our lives right now. And I think there's tremendous impact for people in all aspects of that. I think it's kind of a two-sided coin here. The upside, if there's a silver lining in all of this, is, you know, we've probably accelerated technology broadly. 10 years of advances are being gobbled up in months now across industries, specifically in healthcare. So we're seeing virtual care. I'm guessing a lot of us on this call have had virtual visits, have been able to see a doctor through a drive-through, get a COVID test, et cetera. So that's the positive side. The negative is if you are a provider, if you're a caregiver, if you're an administrator of the system, people are burnt out. It's exhausting. There has not been an off moment in the past 7+ months with this pandemic. We're seeing margins getting absolutely crushed, specifically for health systems, while payers, on the other side, if you look at Q2 earnings, did quite well. So there's a lot of disparity there. And as we've had to shift to serving COVID patients, obviously the ability to see our broad patient bases in the normal ways we have, people coming in, fee for service, et cetera, those numbers have dipped dangerously low in some instances for health systems. Margins are typically on razor thin edges below 2%, and those are dipping even lower, and a lot of health systems will be looking at end of year losses. But the need to care hasn't gone down. So you've got furloughs, you're laying off employees when actually we need them the most. So my hope is this does truly spark the reality that we have to innovate. We are the most lagging industry, even behind government, which gives you a bit of the chills in terms of digital transformation. But we can't keep doing what we're doing. We need to be more prepared in the future. So I think it's woken us up. But we have a long road ahead. COVID isn't over. And I think you're going to see health systems really looking at their holistic approach to healthcare as a business, and how can we innovate and deliver new tools to allow us to optimize and allow our employees to work at the top of their skill level.
Great. And now you work across the entire industry, and Corey actually touched upon something that I hadn't really thought to ask. We always stress about or obsess over patient access and provider morale. How is this affecting, systems finance from a healthcare perspective as well?
So I would say, number one, that the whole advent of the telehealth, the whole surge that occurred, what we're seeing is that, and just to piggyback a little bit off what Corey said, the idea of reimagining the patient experience as well as the provider experience is something that there's going to be a lot of pressure on all of us to really achieve. As it relates to system finances, I think, there's some organizations that are doing better than others, obviously. I think that the other issue that we're seeing is how individual providers are scaling and how they're actually able to respond. And then the third thing I would just comment on is how some organizations have really effectively deployed asynchronous solutions, and that's really given them an opportunity to deal with the surge in a way that they may not have thought of before, and really enable them to maintain relationships with their community, with their patients, perhaps more successfully than they would have otherwise.
Great. Ray, now, as we take it from the high level down to the what's it look like in the trenches, you're an innovator who's actually working with providers. I got my flu shot the other day, and I didn't see a single person sitting in the waiting room. Is that the new norm? I'm wondering if you're in need of seeing your doctor and it's not COVID related, how do we connect?
Yeah, I think it's a really interesting point you made, Kevin, and I would say you're touching on something that I think is particularly interesting. It's there's a lot of healthcare that can be delivered at a distance, and we should be whenever that's possible and appropriate, because it makes that care more accessible and more convenient and changes the experience of care. But to your point, there are things like flu shots and procedures and exams that need to be happening. And in some ways, I think it's better for us not to be thinking about the telehealth versus in-person care as a dichotomy. It's not one versus the other. One of the things I've been saying a lot is that the idea of having a telehealth service line is I think we're doing ourselves a disservice when we think about it that way. It's really about using digital tools to change the way that we deliver care, and hopefully not just change where we can receive care, but how we do that. How can we get patients to the right level of care as effectively as possible? How do we get the right information from all of the appropriate sources? How do we get that in front of the clinician? How do we use digital tools to be able to make their processes more efficient and effective? I think it's really, just like the title of the presentation, it is really about a digital health revolution. It's about using digital tools to transform the way that we're delivering care. And that means remote care. It means supplementing in-person care. It means moving the patient's experience and care process forward and connecting them with the right clinicians and the right information as effectively as possible.
Lose Kevin?
Kevin, did we lose you?
Whoops, sorry guys, I was speaking into the mute. I am so sorry. That is a faux pas on my part. Forgive me. Ray, let's stay with you on this point. Telehealth and virtual care have been enormously helpful during the pandemic, and I'm working on my next book, and one of my key takeaways has been that I think patients as well as providers are more comfortable using the digital front door than ever before. And I guess my question is in the absence of a pandemic, how do we push for continuous improvement in this space? And what does that look like? I mean, specific to that, you mentioned virtual care models. That's a little different than just pure telehealth, isn't it?
It is. And I think that really thinking about it more comprehensively is the only way that healthcare is going to continue to stay relevant. I mean, the truth is, if we don't start thinking about our patients as healthcare consumers, I think that there will be plenty of folks out there who will. If you look at what's happened, there's been a differential impact. I think Anne kind of mentioned this. There have definitely been folks who have been impacted in different ways during the pandemic. In fact, if you look internationally, talk to people outside of the United States, it's hard to explain to people who aren't really familiar with the U.S. health system how it is that we could be in the middle of a global pandemic with massively heightened patient needs and for health systems to be struggling financially. That just doesn't happen in other developed nations. And even here in the United States, we see companies that are digitally forward, folks who have more of a digital presence, they're actually, they saw a net positive impact to their utilization and their revenues and their margins because of the pandemic. And I think what that means for health systems is it's a forcing function. It means that if you don't think about patients as consumers, if you don't use digital tools to not only change where healthcare can happen, but how it's happening, you become increasingly behind. Companies like Walgreens and Walmart and Teladoc and they're all coming. And I think that the barriers to entry particularly in the ambulatory care space are getting lower and lower. And health systems really have to be thinking about using digital tools to change that entire experience of care.
Thanks, Ray. Corey, can we put the perspective, or can we look at that through the lens of an investor? What do you look for in terms of innovators and how they're driving the change and the disruption in this space, and how do you coach them on solving real world problems in healthcare, and what is it that you look for?
Yeah, no, it's a great question, and I think Ray hit a very important point. I mean, competition is coming, right? Direct to consumer. My 76-year-old father said, I want to see my doctor via video every time. So you look for these opportunities where they're delighting the patient. And there's this opportunity to look at companies and entrepreneurs that are going direct to consumer, or maybe solving a problem where healthcare as a whole has lagged. You can look at those that are going after really supplementing brick and mortar. And I love the term phygital, this idea of bridging physical and digital worlds, which I think we're seeing everywhere else in our lives. The challenge we see as investors is the healthcare gauntlet is daunting. It is, as a startup, you're out, you're raising money, you're trying to build your team, and you're trying to climb this, moated castle that has all of these, darts that are being thrown at you all along the way, security hoops, business processes. Health systems can typically implement maybe 4 new tools a year, and getting to that executive suite where they can make decisions is extremely difficult. So I look at this opportunity across the industry to say, how do we become digital? The push to become digital is a beautiful opportunity for entrepreneurs.
Mm-hmm.
There are new regulations coming down on interoperability, where data will flow more fluidly, and the ability for entrepreneurs who can solve these problems and deliver exceptional tools quickly, and health systems getting their houses in order and being able to take on those new innovations faster is going to benefit everybody. So we really look at those that can balance those. The ones that are the best at selling into executive suites, that's not a real skill. You really want to find those that can partner with health systems, can partner with the payers, those that are going direct to consumer, and really get at those pain points and to deliver an ROI faster than they could if they tried to do it in-house.
Corey, I think you bring up a really interesting point, and it kind of emphasizes one of the things that I'm seeing on the slide here, which is that digital revolution, it does change to the one on the left. It changes where care can be delivered, but it can also be changing how it can be delivered. It is a draw for patients. It does, I mean, at this point, truly, I mean, I would venture to say that being able to deliver care remotely, that classic telehealth function, is pretty much table stakes for healthcare delivery systems.
Yep.
You've got to be able to have it. But that also means anything that's table stakes doesn't differentiate you. And so
That's
I
right.
think health systems have to be thinking beyond that. And then to the one on the right, you've got to be thinking about how do these tools impact your providers. That's the place where you're really, I think, you know, talking about those razor thin margins that healthcare delivery systems are operating under, bringing tools that can help clinicians actually enhance their workflows, make the care delivery process better, more efficient, higher value, more delightful, less provider burnout. Those kinds of things, I think, are going to become increasingly critical to truly differentiate.
You know, and Kevin, if I can add a point to that, and I'd actually love your input, Ann. You know, 2014, there was the EHR mandate, right? Okay, we're all going to have electronic health records. And it was just like a big wet blanket. The amount of time, 25, 30% spent by caregivers on data entry, and it didn't deliver what we hoped it had. But now it is table stakes, right? Now CMS and ONC are coming out with this interoperability requirement. And I say requirement because if health systems think of it as a checkbox, it's going to be onerous, we're going to go pay people to implement this, as opposed to what is the opportunity to use this as a springboard to value? How can we go after, I'd call it the quadruple aim, Kevin, and deliver against those, because we're freeing all of this valuable insight that we've been gathering for all of these years and use that to move forward, as opposed to we're doing it the wrong way again, where we're meeting a requirement. It's kind of the carrot versus the stick. And I really hope that collectively we will think about it differently. Yeah.
And I'm really interested in your thoughts about this one too. But to me, I think that is such a massive thing. We got exactly what we were looking for, or what we were asking for when we implemented EHR systems. We got tools that made it so that we could optimize billing. I mean, that idea of, you know, how do we make sure that we're really solving, you know, foundational problems in healthcare, I think is a really interesting one as we move forward with the broader set of digital tools, not just the EHR systems.
Right. Well, I would just add a couple of things. One is that it's interesting that the right-hand circle talks about driving revenue by making each patient encounter more productive. I think we're going to see the verbiage on this starting to change, so it's driving value, and that the digital experience is going to drive value and make it easier for people to engage in their own health. And I think that's something that's going to change. The other thing that I like to point out in conversations like this, that this has been a problem for us as a nation for a long time in terms of, you know, ensuring that people get care, and the variation outcomes and quality, and the variation even in broadband access. So I think that's something that we will see also change. And hopefully we'll have a lot more uniformity than we have historically.
Great, thank you, Ann. I want to acknowledge we're getting some great questions, so I just want to let you guys know that we will leave time at the end here to address the questions that you guys are posting on the Q&A down here. Corey, let's flip the script here just a little bit. What tools are? I imagine we probably got a lot of providers on the call. So, what tools are health systems not using today that could drive further transformation for them in healthcare?
Oh, Corey, you got the softball. That's not fair.
I know. There's a lot. There's a lot. And it's been because we've been able to get by. I sit on a hospital board, and I see the pain of change. I'll give you an example of a system that I advised. They wanted to implement an online digital advanced care planning. Should be, at least from a layman's perspective, that should be very simple. You go to your IT group, you go to security, quality. They estimated about 400 hours to get that implemented because Susie, who wired this, doesn't work here anymore, and this code. I mean, piecing this all together just is exponential, and the lift is so heavy that we give up. So I think what you see now are basic tasks being done, but not even those that are patient-facing. Think about you want to get your hair cut, you want to grocery shop. Basic things in our lives we can now do digitally. I can get an appointment online. That's still a struggle for some health systems. So I think as you look at what we call the digital front door, this onboarding, paying my bill, getting my labs, scheduling, those are being done, where I think we have a tremendous opportunity, and it is a bit daunting and overwhelming, is looking across the system and saying, if I am a business and I am to compete with all of these other natural forces and, a lot of these incumbents are going to be coming your way, how can I look at this competitively and ensure that I am serving my patients better, their patient experience and cost, but also providing them with a digital experience that they get everywhere else in their lives. So is it integrating my medical devices? There's remote patient monitoring codes now. Great. Is it not being afraid to approach AI? Artificial intelligence, if implemented in certain areas of your business, can be very valuable. Rote activities. My admin walks to the fax machine 48 times a day. How can we take some of that out of the mix and then move?
How can we take the fax machine out of the mix?
Well, that's a good question, but and then moving upstream to higher things like precision medicine and oncology for tools like AI. But I think you've got to start with the basics and say, how do we look at the patient first, and what are some of the burdens we can take off of them, whether it's scheduling a visit or having a video call to see if my kid has a rash. We need to start there, and then you can start to move upstream.
Ann, any thoughts on that?
Well, I'm still reveling in the fact that Corey used the fax machine as an example.
I'm going to send you a Google booth at an event. You can fax us. I went, oh my gosh.
I know. I don't even see it on business cards anymore usually. So I think that, again, these are, you guys are both making some terrific points in terms of looking at from the patient's perspective. I think the other thing I'd say is that we need to take advantage of the fact that, yes, it's been a tsunami of virtual services, but it's happening across other experiences as well. So as Corey pointed out, it's grocery shopping. It's the fact that we used to go into Sephora and try on, skin cream before we actually bought it. All that's going away. And so we have to realize that it's not just healthcare that's changing exponentially, but so many other facets of people's lives. But as we do that, we also have to acknowledge that even though telehealth is health and telemedicine is medicine, it's important for us to not treat it differently. So to extend on that a little bit, the idea that we don't put in different standards or rules as it relates to virtual. Not that telehealth is a panacea, but we want to make sure that, we're not creating inappropriate barriers either, or barriers that protect self-interest in the name of patient safety, but really don't do much good at all.
Yeah.
Ray, what say you? Any final thoughts? Are there gaps, and what other tools do you think providers could be using that would be beneficial for them?
I think it does come down to thinking about it being more than just that substitute for in-person care. I mean, if you think about the most foundational tools do, you think about a video visit or a telephonic visit. We've got really well demonstrated evidence that those work in an awful lot of conditions and an awful lot of patient needs. But the interesting thing is that everything that needed to happen in an in-person visit also needs to happen in a video or telephonic visit. You have to ask the same questions. You have to document the same information. You need to interview the patient. You have to do all of that work. Everything that had to happen in an in-person setting has to happen in a video setting. And you're also incorporating in the complexities of a remote encounter. It's arguably just as hard to be doing it in a remote meeting as it is to do an in-person meeting, and maybe even harder. How do we bring in tools that really change that? How do we, when clinicians are spending 70+% of their time on low-level, information gathering and documentation, we've turned them into data entry folks rather than clinicians. How do we use tools, digital tools that can change those kinds of problems? We've made it so that you can deliver care remotely now for a very long time. Now, how do we make it so that that process is actually better, more thorough, more consistent, more reliable, more accessible, more affordable? And I think those kinds of things are where we have to be putting our heads at.
Ray, you've raised some fascinating points there, and I get the impression that sometimes in talking, even within healthcare, that remote care is seen as nothing more than a substitute for the in-person care visit. How is virtual care different, and how can it make a greater impact? And what are your thoughts on that?
Well, I just think that it's, as Ray said, that there has been so much that can be replaced using and increasingly can be used digitally. So I think the other thing that we're becoming sensitized to is things like the way digital tools can support or really eliminate the need for example, in COVID testing, there is a huge false negative, right? And so our opportunity is, as you think about some of the remote monitoring devices that can really ensure that you're tracking your temperature, your heart rate, your respiration rate relative to yourself, and really giving a much clearer signal on what's happening. So that's personalized medicine, but it's also remote monitoring. So I think that what's been really fantastic about this whole experience is that so many people have used virtual services, and the response has been, for the most part, pretty positive, both on the part of consumers and clinicians. And then, therefore, you're going to see just a lot more innovation as people look to say, oh, what could I do differently in all this? To Corey's point, you're going to see more innovation coming out of this.
Fair play to you. Corey, any final thoughts on that one?
No, I think hyper-personalization is a great phrase to think about. And I'm a mom. My kids have been in my house for the past 7 months along with me. And the idea that you go to your pediatrician, they've known you forever, and I've been able to see them remote. They've adapted, and it makes me feel relieved. I trust them. I I want that across my healthcare experience. I want transparency. So if we all put ourselves in those shoes and say, if you can deliver that to me and help me reduce my cost of care, of course that's going to supplement the healthcare system's financials, right? But you've got to look at it across, I think about telehealth, it is a bit of a loaded term, but look across the healthcare system and think about, okay, emergency department, probably can't automate or do it virtually as much as you can primary care. Very clearly we can do that. Chronic care, there's a tremendous opportunity for us to think about specialty and chronic care. What pieces of that can be done outside of the physical touch? A lot of it. Chronic care is ongoing. We know what those metrics are, and just adjust your temperature, your blood glucose, et cetera. We've got to start to think across the continuum of care, for everything from check-in to, delivering the care at the point of care and what is getting those folks to the right place, and then thinking about that person along the way. And we know a lot about our patients. Probably know where they work, where they like to shop. We've got to find ways to surface that and bring the human back into it and allow caregivers to deliver that personal touch, but in a multimodal capacity. Just kind of changing the paradigm a little bit of how we think about delivering care.
Corey, there's two really interesting things that you had in there. One of them was that humanization. I'm a big believer that we've arguably through we've been forced to just keep turning up the treadmill on our physicians and clinicians because there's so much patient demand out there. We just keep telling them they need to be seeing more patients. And then we give them tools like our EMR systems that have actually had a net negative impact on clinician productivity. And those kinds of things are arguably sucking the humanity out of the care delivery process. And I think it's really interesting to be thinking about the fact that bringing better digital tools can actually give the clinicians the capacity they need to bring some of that joy back into their work and bring some humanity back into the healthcare experience for patients. And then the other one that I thought was really interesting, to put a little bit of a specific example on what you were talking about, if you think about only virtual care as removing geography as a barrier to care, it means you slice out whole sections of clinical value that can be impacted. And putting a specific example on that one, just a simple thing happens to lots of people, a broken finger or a broken toe. You're not going to be treating that via traditional telehealth. But if you start thinking about it across modalities and you say, how do we use digital tools to be able to make that experience better? How do we make those experiences connected to each other? Somebody who broke their toe, they take a picture of that and they start their interview and you get that information to a clinician, get them not just checked in at the urgent care clinic, but actually have them set up with the x-ray and the chart note all ready for the clinician so that they land and go immediately back to imaging rather than spending 40 minutes in the waiting room or 2 hours in the exam room waiting for the test that we could determine they needed before they even left their house. And now all of a sudden we've used these digital tools, not only we've connected those locations of care, whether that's from your home, whether that's urgent care, whether that's the clinic, we recognize what the patient needs. We make the process of care delivery better and more efficient. We get the information to the right people, and it becomes much less about just the where and much more about how can we truly transform the way that we're thinking about this.
And as a person, I take a deep breath and go, wouldn't it be delightful? Oh, sorry, go ahead.
Exactly.
Sorry,
and for business, it's quite stickier too. I mean, you're going to that urgent care clinic because you've got your imaging or you got your order waiting for you already. Sorry, Anne, go ahead. What were you going to say?
No. I would just say that what you're talking about, what you're describing is meeting people where they are, which if you think about the best experiences we have, that's what's happening. And what you're talking about is exactly that. I would go a step further, and let's say you're talking about a fracture or an orthopedic intervention that's a little bit more extensive, and think about everything that's done after the fact in terms of rehab and physical therapy. What I think is
Absolutely.
so cool are the tools that are coming out that, again, meet people where they are instead of the schlepping to the hospital to go to PT every day or every other day. You actually have these tools that can make it easier for the consumer, the patient in their own home, to take care of things themselves. So I love this idea of meeting people where they are.
Yeah. And coming back actually to something we talked about a little bit earlier, the truth is that if health systems don't do this, somebody will. I mean, Amazon Care is not just thinking about how to deliver care at a distance. I mean, they're thinking about the logistics and the experience and the efficiency of care from identifying patient needs and reaching out to them, all the way through to prescription and pharmacy fulfillment within an hour. And I would say with pretty high confidence that is the scope of, that kind of breadth is the scope that they're looking at, and they're not alone in that. This whole pandemic has massively accelerated patients' expectations around digital healthcare experiences. It's accelerated health systems' acknowledgement that digital tools are an important part of it, and it's accelerated new entrant competitors into the space. We see, was it Baptist in Florida? They committed to $100 million for their digital transformation over the next couple of years. And that's the kind of thing that we're really going to need health systems doing, is committing real resources and a truly transformational mindset about what can we be doing digitally that we hadn't done in the past.
Well, this whole concept of delighting customers in healthcare is something I think we can all get our heads around, isn't it? Corey, I want to kick this next bit of the conversation off with you again. I picked on you a couple slides back, and I asked you what the gaps are, what systems weren't, what the healthcare systems were not using. Let's flip that one. Now that telehealth is more widespread, what tools can health systems be using to drive patient satisfaction and to Ray's point, recapture patient volumes in the face of new disruptive entrants into the market?
No, it's a great question. One of the first things I think you need to do is patient segmentation. And Anne was raising this, meet the patients where they are. Everyone on this phone call today might have a little something different. I might prefer to go in person every time. Ray might prefer to text with his provider. Anne might prefer a phone call or a video visit. So there's even that first level of, we have all of these different modes of communication today, and starting to really understand your patients and the way they want to engage with you, and having that capacity across your organization. So I think it's also very, very careful and thoughtful that we aren't, ramrodding one mode of a new way of being to every patient. We have folks, Central Oregon is a great example. We have a lot of remote, communities and folks that if you could see them virtually, you can capture that group. You can care for them at a lower cost. And so I think we've got to think about patient segmentation first and foremost. I mentioned this earlier, but I do think it's really important that we start to think about how we're piecing together the pieces of our lives. If you're wearing a remote monitor, how does that communicate with your care provider, and really being proactive about care? I mean, we are a hospital system, U.S. health system, that is built on acute care and emergency care. We've got to flip the paradigm. We have to be on the front end of that and really start to empower, and we want that, I believe, as patients, to know more about how we're doing. Ongoing, how can we turn this to more of a proactive wellness maintenance discussion, and how can digital tools and all of the information we already know about ourselves inform our behavior and inform our providers' behavior to treat us before it becomes a crisis. And I think the last one is transparency. And I can tell you, and I think everyone will agree, you get a bill and you have no idea what all of those costs are. So there's just so much overhead in our system that we have to if it was your own business, what would you do to piece this apart and start to find the waste in the system and remove that? And I think transparency in the actual cost of what we're doing and the pricing to the patients has to be the next wave, because patients are going to demand it. Like Ray said, they can go to Walgreens and they know it's going to cost them $22 to get that service. I would go there every single time.
Well, you've raised some great points there. And, across the industry, what are you seeing?
In terms of?
What other tools that health systems could be using to drive satisfaction and recapture volumes?
So, I think, and Ray touched on this before, there are a lot of different modalities associated with telemedicine or telehealth. One, of course, is synchronous. The other is asynchronous, which is more chat forward. And again, it really proved its mettle, if you will, during this surge early on. And then remote monitoring. I think that we're going to have to sort through a lot of challenges with that, though, because you have the self-service tools, the digital tools, and then you have tools that are more condition monitoring or health monitoring. So a lot of experimentation with all of that. I will say one other thing, though, because as I was listening to Corey talk about segmentation, I saw some really interesting research recently talking about how people are coming out of this pandemic. And I think one opportunity for health systems as they think about segmenting their patients is to understand who is still terrified by what's happening versus who are the patients that are comfortable going back in physically or engaging differently than they have in the past. And I think that's going to be a segmentation step that doesn't come naturally to us as healthcare providers, but we're going to have to engage in.
Terrific. Thank you. Ray, any final thoughts on that?
We've seen health systems really be successful using tools that make the care delivery process not only more convenient, but easier. And I think that that's really where we're focused as a company as well. We think of ourselves partly as a telehealth company in that we enable health systems to deliver care remotely. But we really just as much, and maybe even more so, think about ourselves as a care process automation company. How do we, regardless of what setting is appropriate for that patient, how do we use those kinds of tools, whether it's video, whether it's asynchronous, whether it's AI, what are the right tools to be using to make sure that patients have easy access to care, that they find their way to the right level of care, that we've gathered the right information from the appropriate sources, and we've gotten that information in the most actionable, usable format possible in front of the clinician. How do we get that information back into the EHR system where it belongs when that visit is concluded? How do we follow up with the patient to be able to make sure that we're connecting with them and confirming that they're getting better in the right way? All of those are steps that are part of that care automation process. And I think the interesting thing is that by taking that approach, it really is applicable across that segmentation. It's applicable across those venues, whether you're afraid to be coming into the clinic, whether you prefer video encounters, whether you're a low-income patient who doesn't have Wi-Fi and is on a pay-per-meg cellular plan. All of those things, all of those situations, if you think about it not just as what's the right venue or setting for the patient to be getting care, but what are the right tools to be able to make that care delivery process more efficient and valuable and accessible and affordable, I think that really changes the way, the impact, the level of impact that you can have. And we've seen that health systems have some pretty remarkable effects from that.
You're talking about streamlining workflows, it sounds like. I guess, how does delivering the right care at the right time how does that help drive revenue for health systems?
Well, if you think about this, we've seen health systems ramp up their utilization of their provider capacity to meet COVID demands. As we've seen these waves of need come up in different states, we've seen them be able to ramp up and be able to meet those patient needs and free up clinician capacity. So that's part of it. Why can't health systems go out and get more market share? The reason they can't go get more market share is because they don't have enough capacity to be able to meet the needs of the patients that they have now. When it's 5 weeks for a new patient to come in, that patient's shopping for something else in those 5 weeks to be able to figure out how they can get in and get care. And that means that you're losing that opportunity to be able to go get more market share. If you're capacity constrained by the number of clinicians that you have and the number of visits that you're able to provide, that means that you are missing out on those revenue opportunities. We've seen health systems provide 250 visits in a single shift with a single provider using care automation tools. And that is a massive shift, not only in the level of service that you can provide to your patients and the experience of care, but that's a clear driver of revenue opportunities. When you can make your video encounters 3 to 4 minutes long instead of 18 to 22 minutes long, that opens up new revenue opportunities. It makes it so that you can, and the beauty of healthcare is that those revenue opportunities also mean that you are improving patient access. You're improving the ability for patients to actually get the care that they need. So it's not all dollars and cents, but there is clear dollars and cents behind the positive impacts that you can be having in that care delivery setting.
Great. Thank you, Ray. I want to just move on just a little bit because we're starting to get some, good questions that align to some of the discussion points. And I'm going to sneak one in right now. I think one of my favorite topics is regulation, friend or foe. What's the ATA doing to help ensure parity? And if I could sneak a question in here from Maureen Beverly, does digital health decrease or increase health inequities in the delivery of healthcare?
I think that's not an. Sorry, go ahead, Ann.
Go ahead, Ray. That's fine.
I didn't mean to cut you off there. I apologize, but I was going to say I don't know if that's a totally fair question because I think it depends. But what were you going to say, Ann?
I think that we have to look at telehealth as a means to an end. It is a way of providing, as you suggested, Ray, greater access. And I think that what happened, obviously, with the pandemic is that we saw a huge increase in the volume of services, and yet a significant portion of the population in the U.S. was left behind. And that is not because of telehealth. That's not the devil. The issue has to do with broadband or connectivity, or even having access to devices that allow you to partake of it. So within the ATA, what we're doing is really focusing at a federal and a state level on what we could be doing to ensure that the regulations and legislation that were favorable remain permanent, particularly at the federal level, and then recognizing that there's a lot going on amongst the states as well. Likewise, we're working to really convey the stories and the impact of telehealth because, it did change people's lives for the better. The modality made things better for a lot of people. And so we'll see increased focus on that as well moving forward. I think, parity is sort of a gnarly topic. I think the most important thing is that we provide mechanisms for fair reimbursement and fair payment for this, and not to get into price setting, but really focus on the issue of fairness.
And I agree with you. I think the interesting thing is, I think we have to acknowledge the fact that the digital divide has impacted disparities in healthcare in a way that's challenging. Folks who have access to broadband, folks who have access to devices, when you can't get care in an in-person setting because of a pandemic, those folks are differentially negatively impacted because they don't have the same access. Folks who are less tax savvy, folks who have lower education backgrounds, all of those things do have a negative impact. To your point, that's not the fault of the technology necessarily, but I think it behooves us to be thinking about the technology that can reduce those digital divides. It's one of the reasons why, when we're using asynchronous technologies, it gives us opportunities to be able to actually reduce that. Lower bandwidth. I mean, getting an asynchronous telehealth visit uses about the same amount of bandwidth as checking your email, as compared to video, which uses reams of data and can be quite expensive. Even if you give away video encounters to a low-income population, if they're on a pay-per-meg data plan, a 10-minute video encounter costs them $15 to $20 in data charges, and that's not something that they're willing to be able to do because that's money they could be putting towards groceries. With asynchronous tools, you can also do things like translation. We've seen health systems in New Mexico, Arizona, South Carolina, California, using tools to interview patients in their native language, gathering that information and then doing a real-time medically certified translation over into English chart notes. That's a real leveler. That means that patients are able to get care in their native language in the same 6 to 8 minutes that it would take for somebody who was getting interviewed in English. That really changes the way that care can be delivered. So I don't think it's as simple, Kevin, as being able to say whether digital health decreases or increases health inequalities. I think it's about how do we use it and what are the right tools.
Okay, fair enough. Let's do a follow-up question on that. If telehealth encounters cost less than face-to-face, why are they billed the same? Aren't we trying to use the technology to reduce healthcare costs? That was contributed by Stefan Keeler.
I'd say that that's not a given. We've certainly seen health systems, because the time to deliver care remotely can be just as long as it is to be able to deliver care in an in-person setting. It's not always cheaper. It can be, and I think that we need to be thinking about how do we pass those savings on when they're available to patients. But it's not a given. Again, it depends on how you're using them, and that's part of what we need to be doing in this digital revolution, is thinking about the tools that not only change where care is getting delivered, but how we're doing it and how can we be actually having a true positive impact on the cost of care. Healthcare costs in the United States are going up at twice the rate of inflation, and they have been for decades.
Yeah.
We've got to bend that curve.
And I'd argue we're using the same. The infrastructure hasn't changed, right? So we're like, well, that's what we bill it under. So it's like we're just moving this new paradigm to what exists today. And I think, Anne can probably speak to this all day long. I mean, we can't think about time in the same way. I am happy to pay for something that took me 1/3 of the time. Because guess what? I got all of my time. I mean, so I think there's got to be this revolution isn't just in how we deliver care to patients. It's our business models, it's our strategy, it's policy. It's big. Let's be very clear. This lift and shift, I'll call it, is not insignificant, but I think it will change the way, and I say this, the way we do business. And, nonprofit hospitals especially have not always thought in that capacity. I think there's going to be a new layer of we're delivering exceptional care, but we have to look at all these different factors and reimagine and change the way that then reduces costs and gets passed on to our patients. So I think today you're just seeing that natural parity because it's all we have. That makes sense.
And I would just add on to that the regulations have the waivers that we've seen and the relaxation, it's really enabled regulation to catch up with what technology can do. And while some of us may be in a situation like Corey, like myself, where we're willing to pay more to accelerate a process or to have something done faster, again, there are a lot of people who have been precluded from having access to digital resources because of restrictions on regulations, and that needs to change on a permanent basis.
Yeah, and hats off to you and other organizations like the ATA that are doing the work of helping legislation catch up with innovation. It's necessary. We've got to be able to keep pushing on that in order for us to be able to get the benefits, particularly in a highly regulated industry like healthcare, that are possible.
Thank you.
And further to that point, Ross Collins would like to know, whenever there's a change in the dynamics of how services are provided, especially electronically and digitally, there's always people who attempt to fraudulently exploit these improved electronic services. How do you believe fraud can best be managed, especially from a payer perspective? And do you think this increased fraudulent activity could impact the growth of telemedicine and virtual care models?
Well, thank you, Ross, for the question. Oh, sorry.
Yeah. No, please, Ann, go ahead.
I was just going to say that the ATA co-convened a task force recently with NCQA and the Alliance, and our area of focus was on program integrity, which is code for fraud, waste, and abuse. And what we recommended was that the industry, particularly payers, commercial and public alike, that we really use technology more deliberately to detect fraud, that we not create separate mechanisms for telehealth fraud, because if you have somebody who wants to cheat the system virtually or in person, they're going to figure out how to do it. So we really advocated for not coming up with creative mechanisms that are restricted to telehealth only.
Great. Anything else on that?
No, I think Ann said that beautifully.
Great. Boy, we have a lot of questions. We're not going to be able to get to all of them. We're in the last 3 minutes of our session here. I just want to remind everybody that the questions that are posed here, we will do our best to get back to electronically. So if we don't get to them online here in the podcast, we will do our very best to address them. Some of these are just a little bit too large to ask, but one I can't resist, and that's the question from Debbie Corlin on how AI is going to affect the delivery of healthcare, particularly with regards to virtual care and telemedicine.
Yeah, I think that in healthcare, AI has been used historically to be able to help physicians be smarter. I think that was the original applications that we saw around AI. If you looked at, Watson, the idea was it could comb through, petabytes of data and be able to identify the things that the clinician may have missed. And I think that's an interesting use of it. And I think, there's an expression that every physician learns in med school. It says, when you hear hoofbeats, think horses before you think zebras. And I think that those kinds of AI applications can be really helpful in making sure that when it is a zebra, you identify it as the zebra that it is. And I think that's hugely valuable. But for 99.9% of the cases, it's not a zebra. And in fact, the challenge that we're facing is really helping the clinicians have the tools that they need in order to be able to deliver the care more effectively. And I think that that's a very different application of AI. That's AI to automate and streamline rather than AI as really a substitute for that clinician judgment. I think we see we're going to see a lot more impact from those kinds of AI applications in the near term than we are around that strong AI that can be an alternative to a clinician or even a supplement for their clinical judgment. It's really using AI as a supplement to their workflows.
And any other thoughts on that?
I would just say that AI is already being used. And if you think about how people are kept safe in their home and using AI to monitor and make sure that their vital signs or whatever the different conditions that they're home for are under control, I think that that is a perfect example of how AI is already being deployed for the benefit of the consumer. And again, you know, think back to the consumer experience and what they're trying to get out of it. And I think that's really where we see the future going. You know, the exam room of the future is going to be your home.
What about you, Corey?
No, I think great points. I mean, chatbots are a great example. A lot of people have Alexa in their home, regardless of age, right? So there's an opportunity, I'd say, to tee up the need for that in-person visit and make it really optimized for when you're in front of the doctor. So you can see that both in administrative tasks we've talked about, maybe even preliminary diagnosis, so then the doctor just reviews it, all the way through to imaging, right? A machine can look at an image, a radiology scan, and tee up for the expert, the doctor, the radiologist, to then make the final decision, all the way through to specialty care like oncology. So I think AI needs to be kind of demystified and broken down to different components from inside the system to outside where it can be applied. But it's not going anywhere, that's for sure. I think if applied in a thoughtful manner, we really can, it goes to that reducing burden, time, and waste in the system and in care delivery.
Terrific. I think we just hit the top of our hour, everyone. And I just want to remind you, there are a lot of great questions here. Anne and Ray and Corey and their teams will do their very best to get back to you if we weren't able to get to one of your questions here on this session. Some of them were just killer. And I'm glad we were able to cover the ground that we were able to cover today. So to the panelists, I just want to say thank you very much for your insight, for your perspective. It's not often that we're able to get you all together in one setting like this, and we're grateful for your time. And for those who dialed in and joined us, thank you as well. All the best to you and your families. Stay safe.
Thank you, Kevin. Thanks to Beckers.
Thanks, Kevin. Thanks, Kevin.
Thank you.